Hey, Dr. Fisher here. I'm the creator of Fisher Traction, which you have currently in Mark Urgent Care. I want to give you a quick tutorial on how to set it up, how to use it, and some things that you might want to communicate to your patients for them to use it and utilize it at home. So here is the neck unit, which is all blue. It's got the R and the L for the right side and left side. This is for the neck unit. This here is our heavy duty XL lumbar unit with the red bungees. So this is for patients that weigh over 230 pounds up to 320 pounds. And this one has the hip harness, which is much larger. This one's almost all black other than the bungees, okay? Here are our inflatable knee wedges that go along with our lumbar units. And these come in the boxes that you have there in the office, okay? And this is our shoulder wedge that goes along with the cervical unit, which again is also in the boxes that you guys have inside your offices and you give to the patients. They come with instructions, they come with a QR code on the outside of the box, so your patients can watch the videos how to set it up at home. There's also videos on when to use it, what types of conditions it treats, how frequently you use it. There's 10 different videos that the patients can watch so they'll know how to use this really, really well. This little tutorial is for you guys. So now, just real quick, I'm gonna show you how easy it is to set up for the neck and the low back. So the neck unit, and I'm going to show you kind of an advanced technique that patients can use after they're out of pain. They can use this shoulder wedge. I'll show you how to use it and I'll explain why you use it. So we take the neck unit, okay, and we stretch it out at its resting length, and then I take my fist and I put it in between so it gives me an idea of how far the end of the traction unit should be for the shoulder wedge. So when I lay on the shoulder wedge, I'm already in the proper position to get directly into traction, okay? So how I do this, I hold the release strap in one finger, I hold the traction in the other, and then I slowly get myself down, lining my shoulders up with, let me get this out of the way so you can see it a little better. I'm lining the top of my shoulders up with the top of the shoulder wedge, so when I lay on it, my head can go all the way back, just like that in extension. So now, when I put the cervical traction on, I'm already in the proper position where the traction is already engaged. And some people, just like this alone is enough traction for them. Others, if they want more traction to increase the traction force, they can slide the buckle, which tightens the whole system up, creates more pull. And if that's not enough, they can scoot away from the door, and that also will increase the traction force. Now, here's the release strap, which is hugely important because this enables the user, the patient, to do intermittent traction, where it's not just constant traction. They can mitigate the traction force by pulling on the release strap. And when they pull on the release strap, then they can actually go through active ranges of motion, turning and moving their head, extending back further, helping them to increase their ranges of motion, which helps promote faster healing. Because a lot of these patients that are going to get these units from you, they're work-related injuries. So we want to try and return those people back to work as fast as possible without any limitations, without any permanent or temporary disabilities. So the sooner they can get into this system set up with the shoulder wedges, start going through the active ranges of motion, it's going to help propel them to get back to work sooner, okay? So it's not only just for pain relief, but this is also has a rehab component, okay? And then to get out, all you do is slide it off, slide it out, okay? Patient can get up nice and slow, just like that. So that's for the neck unit. Now, the low back unit, now pretend I'm on an even floor at home. You have both of the knee wedges, okay? So all the patient would need to do is slide it over their shoulders, down to their hips, and slide the buckle tight, okay? Then they can sit down just like this, okay? And right now there's no pull in the traction. And then as soon as I lay down, you can see the traction is starting to pull. Those bungees are engaging and they're creating the traction pull force in my low back. Now I can actually scoot back and create even more pull. Then I can slide the knee wedges underneath my knees. And now I'm in a perfect relaxed state. My hamstrings are relaxed, which helps relax my low back, which enables a deeper pull into the discs, into the areas that are generating the pain for the patients. Okay, and then I have my release strap, which I can pull the release strap to mitigate the pull force for the intermittent traction. And the protocol is be in traction for 5 minutes, then pull the release strap for 15 to 30 seconds to give them a resting phase, then let it go, and they're back into traction for another 5 minutes. After that 5 minutes is up, they pull the release strap, another 15 to 30 seconds to rest, let it go, and they traction for another 5 minutes. So each treatment protocol for the neck or the low back is about 15 minutes total. And the great thing about traction is it's so safe, it's so helpful. They can traction for more than 15 minutes. Studies have shown the more frequent, the more consistent, and the longer you do traction, the greater the benefits. Now, to get out, super easy. Slide the knee wedges out. They can slide down just like that. And some people might be in a lot of pain, so they can't do a sit-up to get out. So all they would do, roll to the side, push themselves up, okay, and they can even slide out of the traction underneath their hips and then get up and crawl out and then stand back up, okay? So we're excited for you guys to have these and offer these for your patients. If you have any questions, you can email us at info@fishertraction.com, or you can call us at my office at 714-550-0788. I'm here for you, and so is our staff. Thanks.